Hi, good evening. How are you? It's been some, well, today it's been some strange energies for me. I mean, I've just done some major cleansings for myself and I felt really peaceful. But then this morning I had something pressing me here again. So, yeah, I guess I have loads of information to download, so I needed something to tell you. So, yeah, I spoke about PTSD or post traumatic stress syndrome in my last video in Serbian, so I'm basically speaking about the same thing tonight. Why? It's kind of an issue here with us. And I thought, I mean, for a while now, I had a feeling I should speak about that. And my last couple of clients sort of directed me into that direction, but I've been thinking about it for a while, but it became pretty loud and clear after my last client, uh, because we had a war story. And basically, uh, here, where I am at, we're living in a post-conflict society, in a, well, not a war zone by itself, but in sort of a militant society. And we've had a couple of wars, and for the last, I don't know, almost 50 or well, more years, we have been through major wars. So yeah, so I PTSD because um, it's a work on trauma. Everything I do in sessions is working on trauma. And um, looking with on my clients, I mean, not all of them are um, sort of directly impacted with some sort of trauma in this particular lifetime, but everything that we are dealing with about from the previous lifetimes is dealing with trauma. Why? Because if you go to the we can go to lives that have been nice, but that usually doesn't really happen because you don't have any business there. We work on things that are not finished and that were traumatic for you, that left an impact, that's still pulling you back. So yeah, I pretty much decided I should speak about what post-traumatic stress syndrome is. It's basically it's a mental disorder. It's a anxiety disorder, so it's a problem with mental mind and with ego. Uh, and this is what happens after a big shock. So basically, when we experience something that's really hard, that's traumatic, uh, and when I speak about post traumatic stress syndrome, I'm talking about some violent things that have happened to you. So whether that is a tragedy, uh, um, a car accident that you've been through, mm, other accidents that you've been through, uh, something of that kind that you observed, or somebody from your family undergone that, a sudden loss, a traumatic loss, uh, whether that is a loss of a person or a property or some big loss. Then violence of all kinds, especially physical violence, but psychological violence too. So basically, this goes for the domestic violence. So if you're living on the prolonged violent system, which can be a family system or a society or a culture or a war militant society, that can cause a conflict because you're basically constantly under pressure of some kind of violence, whether that is systemic violence or something that you experience personally. But basically, for what I do for today, I'm talking about domestic violence mainly, and I'm talking about child abuse. Uh, because mainly I also work, I mainly work on um, traumas from childhood, and I insist on going through childhood because many of my clients have had problems, problematic childhood, and even when you don't want to go back there, we it's needed. So this goes out to children that experienced violence from a family member, um, then victims of rape and any kind of abuse, incest, things like that, and war victims and war veterans. I know this is not sort of a popular topic, not lately especially, but it used to be at one point in this area around here. And especially since my background is, I mean, I was a college professor, university professor, and I taught psychology and educational subjects, and then I specialized in peace studies. So I learned a lot about this topic. So trauma healing was something that was of my interest, and I spent a lot of time studying that. And then, I mean, I had a lot of audience for that, and I had my own personal experiences too. So, uh, yeah, this is something that I'm quite familiar with. So I decided to make this videos to make it somehow closer to the wider audience. So basically, yeah, this happens. I mean, if you think this is something that heavy that I'm just talking about, it happens. Yeah, we have from all over this positivistically oriented psychology, which is needed, and especially in our society here lately, there is a big need, and we all have a big need because our psychological needs are unmet. And it's a certain point of time we all experienced a trauma because our country broke down, because we experienced direct or indirect systemic violence and war and bombing, and we were all under trauma. Yeah, nobody speaks about it. We only speak about it when we are commemorating something, which is fine, but not good enough, uh, because it's only tying us to this event, and it's drawing our energy to there and not releasing us from what actually happened. Because you need to work through what has happened to you, uh, to be able to be free from it. And yeah, basically. This goes also for the regressions, because trauma works in the same way in past lives and in this lifetime too. Anyways, yeah, I had more. I was. It was not a really good day for me today, so I was really much more inspired when I was making video in Serbian, but I'll do my best. Yeah. Um, what happens when you experience trauma? Uh, uh, your mental mind shuts down your emotional body, your emotional mind, so that your emotions cannot come up to the surface, and your instincts take over, which is good for that moment because this helps you survive, especially if this is some kind of trauma that is um, life threatening. So you need to run, and you're scared and you need to save your life. So it's quite normal to feel fear in a situation that's threatening your life. And some people in this moment, when their instincts take over, they don't actually feel fear, they just do. Maybe they feel fear later, which is also normal, uh, or they feel terror at that moment, but they still do, which is normal. It's normal to be afraid in that situation, but you don't get to explore all the other range of other emotions and your thoughts that you have regarding this situation. And if you don't, after a while, because this energy doesn't really go anywhere, it's stuck in your brain and in your energy body, and it's working something, it's doing something there. So if you don't allow it slowly into your consciousness, it's going to find a way how to show itself to you. Usually, you will blow off steam in a situation that's completely inappropriate, or you will get sick, your body will tell you something, or you will make scenes and rant around the people that you care the most about because you feel safe around them to do that. And you know that they won't leave you. So basically, you're tormenting people around you because you are tormented on the inside, and you are not allowing yourself to acknowledge that. So what happens after these threatening situations? After post-traumatic stress syndrome can appear after 3 months after those threatening situations. So it doesn't really come out straight away, but the way it shows itself, the way you will function, and you will know that you're in PTSD, is that you have anxiety attacks, you have dreams, or bad dreams or memories of in dreams of the event. You have flashbacks. You feel fear and terror, maybe not directly connected to the event, or but to something that triggers the similar emotion, something that's similar or reminds you of that event, and which makes you be in a survival mode all the time, and which makes you be in a state fight or flight, because it's similar to what you have experienced, but maybe some time has passed, so you're not connecting it to that situation, but the emotion is the same, so it's making you want to run away or do something else to protect yourself. Basically, this is mental mind protecting you from this situation and not understanding that it is harming you now. And then you can have sleeping disorders, you can have depression, you can have panic attacks, all range of symptoms, which are usually treated in psychotherapy. And good treatment for post-traumatic stress syndrome is psychotherapy, basically the psychotherapy in which you are talking about the event to the therapist. And however, regression has proved to be a very good method for treating post-traumatic stress syndrome, um, because one, it helps you remember if it's a traumatic event that needs to come out to consciousness, that you need to remember, that you need to allow to come to your consciousness. It helps you remember it in a safe way, so you don't have to re-experience it. Or if you still cannot remember it, or maybe it is not advisable for you to go through the same situation, because if it was a war setting, and you something happened to you, you have been wounded, your life has been threatened, or you observed all sorts of things, or you have killed somebody, then it's not advisable to always go back to that situation. But you can work through other stories that come out from other content that comes out from past life. Maybe that was a similar situation, or something that led to that situation that made you be connected to the same story, or some similar emotion that's creating this pattern that you have to go through this experience of violence and conflict and stuff like that. So even if that is a metaphor at the moment, it really helps to treat the situation that has helped in this lifetime, because it's indirectly affecting it, and because the emotion is the same. So this is also healing of your emotional body, which post-traumatic stress syndrome is not. I mean, it is emotional body problem, but not directly. It's more mental disorder. So your um, Emotions would be if you're feeling afraid all the time, and you were afraid for your life, which was fine at that moment, but it's not fine anymore, because if it goes on more than 3 months after, or years after, or it comes up 15 or 20 years after, then it's a sign that you haven't really worked through it, and there is something inside of you that you need to pay attention to look to, and so that it doesn't pull you back. So maybe the event that is your trigger uh, doesn't have to do anything seemingly to what has really happened to you in this lifetime, but it carries the same emotion. So if we treat something in the distant past with the same kind of emotions, like fear or guilt or shame, which usually are the most toxic emotions, they're good emotions. They're showing you something about yourself. They're alerting you and making you act, which is good at the moment when something bad is happening to you. But once when they are not processed, they become toxic, and they basically pollute your energy, and they are trying to find a way to come out. So basically, everything you do, and people who have been through traumatic experiences usually have a lot of sense of guilt because they have survived and somebody else didn't survive, uh, because they have been through something like that, and then they are ashamed because this has happened to them, or it's happening to them. Then so they don't want to talk about it, they want to hide it, because they think that they're weak if they talk about it, because they think that they're weak if they speak openly, that they were afraid and that they cried. Boys cry when they go to war. I mean, I listen to clients who tell me this. I listen to clients in this lifetime who tell me this. I listen to clients who told me this from a past life. And showing off what a big hero you were is your ego talking. Because basically, in the moment when you know your life is threatened, and when you're going there, especially if they are very young, when you're going directly there, you feel fear. And maybe you have developed such a big mental control that you will push out this emotion, and something else will take over, or some substitute emotion, like rage and or hatred. But basically, it's fear what's lying behind it. So yeah, fear, sense of guilt, and shame. Especially shame goes with somebody who has experienced domestic violence, uh, when there was a lot of maybe alcoholism in the family, and then somebody was abusive, maybe not physically but verbally abusive too, but this goes especially to the physical abuse. And if an rape has happened to them, because often victims feel guilty, and very much ashamed because they have to speak about these experiences and relive them, and all sorts of mixed emotions are there. So yeah, why I speak about, because I listen to those stories from my clients, whether this is from the past life or from, I mean, usually they're from the past life, but trust me, I have had my share of listening to people from this lifetime with those kind of experiences, because I was not just a scholar of peace study. I was on the field, and I talked to people. I worked with refugees, I worked with children, I worked with foster home children who parents left them, and some were left in the dumpster. And I mean, I'm very much familiar with those kind of experiences. It's just the first time that I'm actually talking about it, because this is not something that people usually want to hear. And we are all behaving like ostriches, trying to pretend that things like this don't happen, and adding to the situation, because those people who are traumatized need to be acknowledged. This is why they're not talking about it, because nobody else wants to acknowledge what has happened to them. Because we also, when we listen to the stories like that, experience secondary trauma, and we feel guilty because we don't know what to do with this. we feel the need to do something to fix the situation, and we cannot fix the situation. And sometimes this is not what they need. They just need your presence. They need to be acknowledged that this has happened to them, and sometimes that's enough. So when this doesn't happen, then we have dysfunctional families, dysfunctional relationships, dysfunctional human beings, dysfunctional societies, and a dysfunctional planet like we're having now. And we're having a bunch of geeks of dysfunctional governments running these countries and planets. Planet. Why? I don't know why I said planet, but yeah, something is coming out probably. I'm talking about this planet now. Yeah. Anyways, that's what I'm seeing in my society. But looking by the news of everything that's going on around, this is coming out, and we're talking now about collective consciousness, or, well, not unconscious, because some people know what has happened to them. It has happened to them. They just suppressed it and are not talking about it. And they sometimes know what kind of memory wants to come out, but they don't want to let it out because they don't want to remember it. Yeah, it's they start cracking. Basically, when you don't deal with post-traumatic stress syndrome in time, you can have situations like somebody flipped and be, has beaten somebody on the street, or I don't know, somebody accidentally punches a little bit in your car, and then you all of a sudden have this rage attack, and you have to kick the hell out of him, which, I mean, that's sometimes what's happening around here. Or you have people shooting on other people, or you have I don't know, news like somebody just out of the blue, he shot his whole family or his wife, or they just take guns and shoot around kids on the campus. This is why. This is why. Because it's under the post-traumatic stress syndrome that haven't been dealt with. So when it is not dealt, and it leads to situations like this is, well, this is too late for regression, because this is a personality disorder. This is a disassociation of personality, and there are very big mental problems, pathologies, and psychosis. And regression doesn't deal with psychosis. So I'm just giving you the picture so that you can understand, because it's yeah, we can deal with it when it starts, pulling you, when you start remembering, when you have some nudge that you should look at something. And usually when you come to regression, and maybe you cannot, you've been driving car, and all of a sudden you cannot walk into a car, and there haven't been a situation, you haven't had a car accident, or you had it like way back when you were a child. Or maybe there's something completely different, like maybe there was something in your family that caused somebody, when somebody was going on a road trip, and something happened which changed the entire family system and the family dynamics, and nothing was ever the same, and it affected the whole family. So it is in your memory. Or maybe, I don't know, you go on a plane, and all of a sudden you develop panic attacks, and you cannot fly planes anymore. Or you fly into a certain country, and then you can't go back from there because you have a panic attack there all of a sudden, and you can't go on a plane again, and you don't know why. You have to look for why. And maybe this panic attack has nothing to do with planes, but it has to, or flying, fear of flying, but it has to do something with travels, or I don't know. I mean, it can be something that's like completely random. It doesn't have anything to do with the event that's triggering you off now, but it's the same emotion. So it's basically the emotion that you're trying to hide from yourself, and you do not want to go through because you're afraid it's going to overwhelm you. and you won't be able to control the emotion or yourself, uh, and you won't be able to get out of it. And basically, this is actually what does happen when the personality disorder happens, when this association happens, because you don't control yourself anymore. This was exactly what you were afraid of, that you're going to go crazy, and you do eventually go crazy from post-traumatic stress syndrome when it is not dealt with. So, because also what happens in the moment when the situation that you're going through is very difficult, very heavy, very violent, and you cannot run away from there. Whether that's a family violence or abuse or some experience that was, you know, prolonged violence that you couldn't get out of. Maybe it started like a stress, but it continued like psychological violence, and you just cannot get out of there. You don't have the means. Maybe you're a child and you're little and you don't have anywhere to go. And nobody should undergo things like this when they're children, when they're small. But things like this happen. And from what I've seen from my clients, they have a reason to why, usually. But still, when they're not dealt, whether, I mean, you don't deal with them in this lifetime and you haven't dealt with them in previous lifetimes, they grow. They tend to grow and won't leave you until you look at them. So, yeah, nobody should go through this. But shit happens. So, we have to deal with it then. Some people develop resilience, and whatever experience they undergo, they have the tendency to draw lessons from it, which doesn't mean that they didn't feel it. They just had stronger connection to their soul, from what I saw from my clients. So basically, in this state, when you cannot get out of this situation that is unbearable for you, your soul tends to leave your body. There is a small connection to it, but basically because the soul doesn't want to experience this, and it's less um, it's less threatening to you if that happens. Your soul sort of leaves your body, and it's like you're not there, and it helps you survive the situation, and especially if it's something that's in continuation. And then you can see the people who have been children who experience domestic violence and have been abused. They basically are somebody who tends not to be here. Their soul is not fully present, and it's not fully grounded in the body. They're not fully embodied. And this is what we do. Basically, we connect you to your soul. There is a good reason why that happened to you. And the thing is that it's not good to judge the experience of this person because it has happened to them. And it's not good to tell them that it's something wrong with them because they feel the way they feel about that experience, because it was hard. Imagine something like this happening to you. It was hard. So they need acknowledgement, not judgment. And and why am I now talking about that? Not only to tell you that this is something that regression is good in dealing with, and I deal all the time with it. It's trauma healing, and it's really proven to be a very good, effective method for PTSD. But it's because when your soul sometimes is not here and you're not connected to your soul, you're in disconnect, something else can come in there. Some other energy, doesn't really matter in which way, whether something came or you invited something or it's somebody abused the situation. It also happens sometimes during the session that we deal with the energies like that, but this is something that I do not like to do, and I prefer if my clients deal with it in some energy sessions somewhere else, because it's mine to deal with the stories that's behind it, to help you to understand the story, what has happened to you, and where this is attaching at. And yeah, but like I say, like I said, people, we're not talking too much about those kind of experiences, and people are afraid to speak about it or ask for help, and plus people do not believe in it. But I've seen through my clients that something like this happens. So basically, before getting to connect you back to your soul, so that you can receive your own energy back inside of you, we have to we have to clear this energy from you. And this happens throughout the session, but it's really something that I really don't prefer, and I don't see myself as somebody who needs to do that. Yeah, it's not nice. I mean, it's not nothing traumatic for the client. On the contrary, it's just it's a bit difficult for the therapist, and that's why I'm speaking about it. So yeah, I think my business is to connect you back to your soul, and then this energy clears everything from you, not the therapist. But I just needed to say this because this happens, and mainly because when you go to psychotherapy, you don't talk about things like that. You sometimes don't even talk about what has happened to you. You receive medication, and I am against medication. Yes, there are disorders, especially psychosis, that you need to treat with medications, because your mental mind needs to keep control. But there are other energy techniques, like in shamanism and in some ancient traditions. They have dealt and worked with the energies, and they're experts in working with the energies, and they understand energies. And this is what can help you also. And there are plants that can help. There are other methods that can also help. Meditation helps. Many other things help. But I don't think that medication is the best method for treating post-traumatic stress syndrome, although it does help you function and it gives you relief. But on the other hand, it makes you be addicted to those medications. So what happens when you have post-traumatic stress syndrome and you don't deal with it? Besides the flipping of it, you can become dysfunctional. You can become depressed, anxious. You can have panic attacks. You can have addictions of all sorts. You can become a drug addict or an alcoholic, um, or any other. You can develop sex addictions or any other addiction that gives you the fix of making you feel like you're present at the moment, and that like you're here, like you're present, you're feeling good in your own body, like you're feeling you have certain satisfaction at that moment, which well, it turns out to be something else on the long run. But these are the consequences of PTSD. It basically develops, when it's not dealt with, it develops more problems. So if you have some pain, some psychological pain that you haven't dealt with, it is better to deal with it, to take a look at it. And the best way is to talk about it to an expert or somebody you really trust, or find your method that works for you, that is going to heal this part of you, because you need to accept this part of you that's been in pain and that experienced all this, and you need to, before integrating it back in yourself, you need to heal it first, and then you need to love it like you love a little child, because this part of you is underdeveloped. it's it's not irrational, but it is a child. It hasn't grown up. So when you pay attention to it, and when you give it enough love, then it can grow up. So this is basically what integration is. Whether this means that something bad has happened to you or that you have done something bad. I'm talking about regression now, because when we're talking about some trauma that has happened to you in this lifetime, It's the same method, but when we're talking about the trauma from this lifetime, regression, spiritual regressions doesn't exclude psychotherapy, because you need to go through psychotherapy, because you need time to allow your self to accept of what has happened to you and to integrate it. This doesn't happen only in one session of in regression, or only in one session or two sessions or three sessions of psychotherapy, but it takes a bit of time, because you have been developing this for a while, not just overnight. Yeah, something has happened to you overnight, and the best way to deal with it is to deal with it straight away when it happens. But still, it takes a bit of time, because it's a psychological trauma. And even when you're fixing your body and you have an operation, you need time to recover. It's the same thing. It's a different kind of body. So yeah, I there is a big need in our society, in my area, in my Serbian society here, because we have been through wars. Like I said, we had friends who have participated in wars, or maybe family members participated in wars. We had countries that fell apart. We had poverty. We had bombing. We all experienced bombing. We were here. We couldn't leave, and even those who left at the moment were under trauma because they had family members who were here. So yeah, we are all under PTSD syndrome, and we have a very big need here, psychological need, to tend our psychological needs. And this is why there is so many different methods at the moment going on around about offering all sorts of kind of spirituality and quick fix methods. And PTSD is something that it can't be fixed quickly. It takes time, and it takes a lot of care. And especially, it's not good, especially to dismiss somebody who's coming to you with something like this, because you are re-traumatizing him or her, and you're doing something much worse than what has actually happened to them in the first place. So just think about it. This goes out to all of the practitioners. And if you think you have a clue, if it's a habit trauma that came to you, if you don't know how to handle it, you better extend a bit of love and then transfer this client to somebody who has more knowledge, more expertise than you. There's nothing wrong in it, because that's far better than doing more damage. And I've seen it happen. So that's why I needed to say. I myself am also somebody who has experience. I have I have had a lot of PTSD myself. I'm from a family that I've experienced domestic violence. My father was alcoholic. He was abusive and violent to my mother and my brother. Although I was in a state of fear for my childhood, and then I was in a state of fear from all the wars that have been going on when I was a teenager here, and then I was in a bus that was being bombed, and I had a soul split, disconnect, but it's kind of a split, because I was sitting on a road that was being bombed, and I know exact moment and strange experience that happened then. And I know, because I dealt with it, I've had sessions on it, and we returned this part of me, but then this part of me was not healed completely, and that was a whole lot another story that created a lot more turmoil, because I needed to work a bit more to understand what's going on. And I mean, all of our Serbia here, I think we all have sleeping disorders, because I know around, I don't know if you remember, but around 2 o'clock, 3 o'clock a.m., the bombers were coming, and we would all wait to hear them and to hear the detonations where they're happening, and then after that we could go to sleep, because we knew nothing was going to happen until tomorrow afternoon, maybe. Well, that was my case, but I know a whole lot of other people, and I know that many of us function like this now, because we have never had problems with our sleep sleeping patterns before, and there are a lot of people calling me and other people with sleeping problems. Yeah. Was there anything else that I wanted to say? Yeah, I'm. It's not that I deliberately direct this to the war stories, but mainly it is PTSD is mainly connected to the violence and trauma caused by violence, something violent, and war. And there have been some work done here with war veterans around 2000, from 2005 to 2010 or something like that. But there are like many other issues. I mean, I could tell stories about that. Uh, yeah. So yeah, things have had, um, but it's just like through non-governmental organizations where people have been done some work on them privately. But as a society, we actually haven't done anything about it yet. And this, like I said, is a collective trauma. It's individual trauma, it's individual thing, but it's also a collective thing. Because when you are hurt and you don't work on your hurt, on your problem, it changes you. You change, you're not the same. And then it affects your family because it's somewhere, uh, you have direct contact with them, and you feel you can express your pain through different modes of behavior because they're the closest to you, or other people who you care about, your girlfriend or um, um, best friend or whoever. Just it's the same scenario, and then it goes on and on because they're hurt, and then it go hurt people hurt people. So when you don't deal with, when you have dysfunctional families, then there is a transgenerational trauma that goes out from one person, from one family to another. It's the same behavioral pattern that you inherit, but you basically carry in your energy. And there is always somebody, if you go back far back enough, there is always somebody who started it, where it started it, somebody who experienced something, who was traumatized, and it was changed by it. So yeah, the good method for collective work on it is, it's for individual too, but it's mm, oh, I don't know the word in English. Family constellations by Bert Hellinger. Yeah, it's very popular around here too, because we carry, because of all the wars, a lot of transgenerational trauma. And yeah, regressions are really good for that. Meditation is really good for that. What is the group when it comes to the society? Because we have dysfunctional societies, like we can see in our society. Everything that is going on around us now, is because of that. Is um, cause is caused by that. It's a consequence of the post-traumatic stress syndrome and of the society that has experienced collective trauma. So one of the other things that happens when you have a group that experience the trauma together, like a natural disaster or accident or worse, they tend to stick together to those people who have experienced it with them, or help them, or to the families of those who have maybe died in those accidents, because the energy bonds that are created in these situations are somehow strong, and they need to be cleared. And this is something that I just recently understood, but I knew them in the psychological, when you have a disaster, and the psychologists are advised not to break up the group, but to leave them together until they naturally are ready to let go, and work with them in the group sessions with the same group. So that I've been thinking about it. So I kind of, yeah, I don't understand yet very well why these bonds are so strong. There is probably a reason somewhere behind why these souls decided they were going to experience something like this together. But yeah, just think about it when you work with people, and when they need to, when they tend to express dissatisfaction with the situation that they are living in and the society or the group they're working with, or maybe just look for something like that and these kind of bonds, because it's kind of this survival's guilt, because if they leave, they're kind of disloyal to the people that they experienced it with. Yeah, and what is the solution for the society that's functioning in this cycle of trauma? I really don't know at the moment. I mean, yeah, working on oneself, and there has been a lot, enough of us working on ourselves for a while now, and raising the energy and the level of consciousness and speaking about it. But I think I feel these times have passed now, and we have to connect and be in groups, and maybe then together we can come up with something that's going to be helpful in healing the collective trauma and collective um, consciousness and subconscious too, because there's a whole lot of it coming out lately, and it's not only in my society, but I think it's everywhere. But I'm only speaking about my society because it's something that I'm living in, and I'm experiencing it, and I have experienced it, so I thought about it. And I've worked with people who live in this society, and these are the needs of the society. So there is a need for something, for something for the collective to be healed, not only an individual. Yes, we heal the collective when we heal ourselves. That's true. That's so very true. Uh, uh, but it has, when you're in a group, it has more impact. It has impact on the larger groups because we're all connected. And if you have impact in your small town, then you can go further and to the state, and then to neighboring countries. And I mean, I've seen this because I have clients from neighboring countries too, and it's the same kind of thing, because we all had the same experiences here, similar, because some of them had a war directly in on their territory. And yeah, I just needed to share this with you. And yeah, this was not for maybe good day for me to speak about it, because I'm kind of, after that last talk, I and some clearings that I've done for myself, I didn't have the need to speak about it anymore. But I think it needed to be said, and I needed to make the video in English for my wider audience, and we don't know who might need it. So yes, it's a bit longer than the Serbian video. I don't know why. It just, yeah, something was going through my head at this moment. I was about to finish, but why I'm speaking about war so much, not only because we experienced it, but it has to do with the healing of the divine masculine, which I forgot to mention in the Serbian video, because boys go to war. This our not only the society where I live in, but the whole world has been dragged into it in certain points, and we all have memories of it in our energy from this or that time. So yeah, women and children are affected by it too. Women go to war too, but mainly boys go to war. And they're warriors. They're taught to be warriors. They're taught to be knights in shiny armors, and they are taught to give up their lives at a certain point and take lives. And they are hurt by it. It hurts them. They cry, and their hearts cry and continue to cry a long, long, long time after. It changes them. And it changes their families, like I said, and it changes the women around them because they hurt women when they're trained, programmed to be like this. And we need to change that too. And we need to heal this program, and we need to heal this part of the divine masculine so that it can become more loving, so that it's not a god of war or hunting or stuff like that, whatever the archetypes of divine for men were, but god of love. So far we only have one god of love. I mean, Greek mythology too, but they're kind of feisty. So yeah, think about it. It it's that's why it's needed. It's about balance. And before coming to balance, yeah, empowering women and working on awakening goddess and divine feminine energy. But for it to be anchored, it needs to be anchored in our inner male, in females too. And we all have this experience in ourselves because in other lives we have been men. And maybe we led wars at some point. And it needs to be anchored in men too. And before it can be anchored, the old energy and the old paradigm needs to be healed and to leave. So that's why it post-traumatic stress syndrome needs to be the topic that we address and heal when this issue happens, not hinder it and put it on the carpet. And because it creates more problems. And it creates disbalance. So yeah, I think with that, I'll finish. Yeah, said I was holding a citrine because it was mainly the story about power issues and returning the power to yourself, which is the solar plexus chakra, and it it's helping channel this. And when speaking about this, there is some heavy energies, I know, but it needed to be said because it needs to be dealt with not only by certain individuals but by all of us. It's going to be waiting for you sooner, maybe later rather than sooner, but it's going to be somewhere along the road. And for those who are listening to my channel now, and you can take a look at it. And I do implore you to take a look at it in a proper way. Thank you.